Great. Good afternoon, everybody. Welcome to our Innovations in Tobacco Control lecture series. I'm Joanna Cohn. I'm the director of the Institute for Global Tobacco Control, and I am really excited about our speaker today. I'm really pleased to introduce April Roeseler. She's the branch chief for the tobacco control branch for the state of California. And she's held that position since 2014, but has been with the tobacco control branch or unit of the program in the state of California since its inception in 1989. So I think she might be covering this, but just so you know, there was a proposition, a ballot initiative in California, Prop 99 in 1988, that raised the cigarette tax by 25 cents, and that, I think, probably launched the program. And April was there at the beginning, and then in 2016, there was another successful ballot initiative, Prop 66, that raised the tobacco tax by $2. And so in her role as branch chief, April has seen the growth and expansion of the California Tobacco Control Program from $60 million a year to $220 million a year. That's a huge expansion and very exciting. And it's not just that California has the money to do things, but the approach that the California program has taken is quite unique and very deliberate and focused, and I'm really excited that you'll all be able to hear about about that approach. As part of her role at the California program, one of the things that April has done is overseen the community grants program. So that's, again, has been in the past tens of millions of dollars, over 100 grantees that are community-based organizations, local departments of health, etc. So she's a lot of experience in sort of the logistics and administration of a huge statewide program, but also in setting strategic direction and making sure that the goals are reached. April is also a contributor to the recent Surgeon General's report on e-cigarettes. And she's the lead author on a paper with a title that I love. It's called The Quarter That Changed the World. And that was about the Proposition 99, the 25% increased cigarette tax, and what the state was able to do with that. And that was, I think, really written as part of an anniversary of the program, and now we have like a whole reinvigoration of the program. So I'm really pleased to introduce April Roeseler to talk about ending the tobacco epidemic in California, and we're here to do the and beyond. So welcome.
Thank you, Joanna. It's an honor to be here and speaking to you. And the title of this presentation, End Tobacco Use in Nicotine Addiction, End the Epidemic. It's very purposeful that there's a chessboard there because we have to be strategic, and there is definitely an opponent in ending this tobacco use epidemic. So I want to talk to you today about how we got to this vision of actually ending the tobacco use epidemic, but I have another goal, is to disabuse you of the myth that tobacco control work in California is easy. So let me begin. In 1988, Proposition 99 was passed. It raised the tax from 10 cents to 35 cents, quarter tax. A nickel of that was directed for tobacco use prevention and cessation programs. 3 cents went to the Department of Public Health, 2 cents went to the Department of Education for school-based curricular activities. There had to be enabling legislation to utilize those dollars. Lloyd Connolly was the author of that legislation. It was visionary and set us up for success. So here were some of the key things in that enabling legislation. It was prescriptive. It mandated a state media campaign, state and community interventions, that every local health department would be funded, and evaluation and surveillance. It went further. It said that we were to use a community norm change strategy in implementing this program. It said that we were to use evidence-based and research as we went along. So over the years, as people said, who gave you permission to work on secondhand smoke? Who authorized you to work on e-cigarettes? We could go back to our enabling legislation. So on April 10th, 1989, California launched its mass media campaign, and this was the manifesto. It was a print ad that basically said, everybody knows that smoking is the leading cause of death and disability in the United States, but what you don't know is that there's a powerful industry that is culpable in this. So Ken Kaiser was the director of the Department of Public Health at that time, and he ended up having to testify about the media campaign in front of Congress, because one of the first ads that we made took on the tobacco industry. And so basically he said in his testimony, there's no valid defense in support of smoking, and we're not going to apologize for taking on the tobacco industry for this. So about a week after we launched the media campaign, the tobacco industry obviously puts together its plan to torpedo the program. So this is from the tobacco industry documents, where their plan says we're going to try to get the legislature to intervene, we're going to work with minority businesses, we're going to try to convince Dr. Kaiser to pull those ads, and we're going to try to convince the governor to intervene. So this slide tells the history of the California Tobacco Control Program, and I love it, and it relates back to that last slide. So the first year we're out in the program, we have $95 million to spend. And you immediately see this huge drop-off over the next 6 years. Was that because we were so successful at reducing cigarette consumption? No. It was because the funds that were directed and earmarked for tobacco use prevention and education were diverted for child insurance programs, immunization, and maternal child health programs. So then you see this kind of spike up in the late 1990s, and that's because there were a series of lawsuits from the voluntary health organizations who stopped the diversions, but then they had to sue again to get the funding restored. Then around 2001, you see a spike up. We got a one-time only appropriation of master settlement agreement funding. And then you can see what Joanna said. We have this kind of long plateau around $50–60 million, and then this big spike up because of the $2 tax increase in 2017. So I talked about the diversions. So one of the first diversions was there was a bad budget year. So the director of the Department of Health decides, I'm going to solve my budget problem by redirecting the $16 million for the mandated media campaign to fill our hole in the Medicaid budget. So people questioned, was this really about filling a budget problem, or does it relate back to that tobacco industry document and their plan to torpedo the media campaign? So there were a series of lawsuits, as I mentioned. The voluntary health organizations came to the defense of the program. They put up money, they won, they got the money restored. But there's drama going on at the state level, but there's a lot of action happening at the local level. So one of the first things that we went out with at the local level was to push and promote local smoke-free worksite policies. Some of you may have heard about Paradise, California this fall, because this is the town that was basically wiped out in a fire. But this was one of the first kind of ground zeros with the tobacco industry. It's a small rural community in Northern California. The city council passes a local ordinance for smoke-free workplace law. Tobacco industry is present, so then they put it on a ballot. The health officer who's speaking out for the benefits of clean indoor air, he is muzzled basically by the Board of Supervisors that you cannot talk about the benefits of clean indoor air. This is 1992. And from tobacco industry documents, you have the tobacco industry saying, okay, we lost the vote in Paradise, California. We're not too worried. We've got 6 more ballot measures across the state of California. And they basically shot themselves in the foot over and over for overplaying what they did. So this is from the city of Sacramento, where they were sending out all these direct mails flyers, and they listed these emergency numbers, and they were trying to create this sense in communities there's going to be a cigarette patrol based on these clean indoor air laws, that if you're seen smoking, you're going to get cited and go to jail. So there was a big outcry because these were all fake numbers, but this looks like an official document. So then an unusual thing happens. In 1993, Governor Pete Wilson is there, and he picks Bell Shay to be the director of the Department of Public Health. She was a tobacco industry spokesperson who went across the state specifically trying to convince voters of California not to enact the 25-cent tax on tobacco products. So there's a sense, if you're working in the California Tobacco Control Program, somebody is trying to undermine you, and there is a plan. We had this ad that came out in 1994. It's called Nicotine Sound Bites. It took congressional legislative testimony where all the CEOs of tobacco companies are testifying over and over, one after another, nicotine is not addictive, nicotine is not addictive, nicotine is not addictive. So R.J.R. Reynolds sends a nasty letter to the Department of Public Health saying we're going to sue you. So the public face of the response is, no, we're going to continue to air that ad. But privately, the program was told, take that ad off of the air, but that also came out in the news. So at the ground level, people are working on all of these clean indoor air ordinances, and there's about 200 that are passed. And so the state legislature says, we need a state law. So there's all these fights going on at the state capitol, and there is a bill passed, AB 13. And it's going to go into effect on January 1st, 1995. So Philip Morris immediately qualifies a referendum that's voted on in November of 1994 to try to weaken that state law. They lose that referendum. But they come out with yet another plan how to deal with this problem. So they're going to try to work with the hospitality industry, and they want to draw a very hard line and keep bars and taverns sacred, that smoking is allowed. And this is interesting. They want to protect and support the point of sale advertising area. So smoke-free workplace law goes into effect on January 1st, and then the advocates immediately start working on smoke-free bars, and you have the governor of the state of California saying, like, there should be a sanctuary for smokers, and that should be the bars. But the California law was very clever because it was positioned and framed as a worker protection law. So how could you not protect this one class of workers who are working in this one industry? So smoke-free bars did go into effect on January 1st, 1998, and as we all know, the economic downfall coming from these smoke-free laws did not pan out. So a lot of work going on in smoke-free areas, but at the same time, there's a lot of work going on the tobacco issue with sales to minors. So all of you know, 1992, the feds passed this law, the Sign-R Amendment, that requires every state to enact a law prohibiting the sale of tobacco products to anyone under the age of 18 and to enforce it. So California enacts its law called the Stop Tobacco Access to Kids Enforcement Act, and one of the features of our law was that it required at each point of sale a sign that said, hey, the clerk can't sell to anyone under the age of 18. Well, we made a little mistake with this sign because there was an 800 number to report if you saw somebody selling to a minor, because that 800 number was at the bottom of the sign. So when we went out and did compliance checks, we found that the retailers had carefully cut the 800 number off when they posted the sign. So then we learned, oh, you put the 800 number in the middle of the sign. But the other thing that was going on was that this Coalition for Responsible Tobacco Retailing was going around telling all of the retailers in California, you don't need that sign, you just need the We Card sign. So the Attorney General's office found out, and they sued them, and there was a settlement. So a lot of stuff going on. July of 1998, California enters the fray with another 46 states to sue the tobacco industry for the Medicaid costs, from tobacco use. And I just want you to know these lawsuits are a huge deal. This is what it looks like. These are all the records that are boxed up for the lawsuit. The tobacco industry came into the Department of Public Health and cornered off a section of our cafeteria one summer. They copied every single contract, every single progress report. Master settlement agreement in California results in $25 billion over 25 years. $12.5 billion goes directly to the counties, $12.5 billion to the state of California. So the California Tobacco Control Program got $20 million one time only. Bad budget year, 2003. So California, like many states, securitized the $12.5 billion for $4.5 billion. It's all gone. So California was sued many times, but this is one of the most interesting and novel lawsuits that I wanted to share with you. So the tobacco industry does not like the anti-tobacco industry ads, so they sue the state of California, and they try two arguments. The first argument is that they have to pay the tax when they give away free samples of products, so it's unfair that their money is being spent on ads that mock them. So that one didn't go anywhere. Then the second track that they try is that these ads create an environment that they cannot get a fair jury trial in California. So that went all the way to the California State Supreme Court. They lost that one also. So I don't want you to think that it's just all a big mess of lawsuits and drama, but there's a lot of good work going on in California. So the California Smokers Helpline, to me, is one of the most important success stories coming out of California. It starts out as a one-county intervention randomized controlled trial, and they demonstrate that telephone cessation counseling is just as effective as face-to-face counseling, and that most people are relapsing within the first 2 weeks. So you need to have your counseling sessions ponied up in the first 2 weeks, not these kind of one-week interventions which had been going on with face-to-face. They add Asian line, they add teen line, they add special protocols for chew tobaccos, pregnant women users. And, within 15 years from this research, there was a quit line in every state. I mean, that is a marvelous story of research, translation, and dissemination. Today, California Smokers Helpline, as well as quit lines across the country, have mobile apps, chat, texting. We're doing bidirectional electronic medical records. At the state level, California passes the smoke-free playgrounds and tot lots law, but at the local level, they're really focused on beaches. The first ordinance is in Solano Beach, which is in San Diego County, and within a year, every single county and city beach in Southern California is smoke-free. Interesting thing is that there have been 3 pieces of legislation that have gone to the governor's desk to create the state parks and beaches smoke-free. 3 times it has been vetoed. It's in the legislature again this year with a different governor. We'll see what happens. So a lot of people are fairly dismissive of these smoke-free outdoor ordinances because they're not really the big heavy hitters in terms of public health protection that taxes are, clean indoor air, things like that. The local level loves these policies, and they're just kind of widening where these policies are. So they start in parks and beaches, but now they're in, the entire sidewalks, outdoor dining, all of that. And my personal feeling is rural areas which have a hard time with these policies, this is an area that they can be successful and learn how to do policy work. So in 2004, California adopts this tobacco retail license. It licenses the whole retail chain from the tobacco retailers all the way through the manufacturers. There's a fight in the legislature over this bill because they won't really put any public health provisions in it that would hold the retailers accountable for repeat offenses for selling tobacco products to minors. It's really all about tax evasion and illicit tobacco sales. But the voluntary health agencies are really smart. They get anti-preemption language put in this bill that says the local level can pass their own tobacco retail license. And I'm thinking to myself, that will never happen. Well, It did happen. And the state license was a one-time only $100 fee. At the local level, they start passing all of these ordinances. They're $200, they're $300, they're $500. And they're holding the tobacco retailers accountable for multiple violations of sales to minors. And then they start using them very innovative ways with flavored tobacco product restrictions, minimum price, package size, density zoning, all of these really creative things. 2005, prisons go smoke-free in California. But really interesting work happening at the local level. Belmont, which is a kind of upper crust community in Southern California, passes the first ordinance to actually prohibit smoking in multi-unit housing in the units themselves. So this is kind of like a new place to go because this is people's personal space. So these policies are actually kind of hard to pass, unlike outdoor clean smoke-free parks and things. We've had about 62 of these passed. Oops. Huh. So in 2008, California passes a smoke-free car law. And, you know, in some ways it seemed like a kind of a small law because you can only cite a person if the kid is in the car at the time. But there's actually reductions in exposure to secondhand smoke. 2009, really fantastic legislation from the federal government with the Family Smoking Prevention and Tobacco Control Act. Really important is that this law gave states the authority to regulate the sale and distribution of tobacco products. So, you know, we're watching the landscape around e-cigarettes, you know, like from 2007 to 2014, we're trying to figure out at the state level, is this just a fad or is this something serious? So in 2014, we are saying in our office, this is something serious. And so we write an issue memo to go up to our director's office. But lo and behold, our state health officer calls me and says, what are we going to do about e-cigarettes? So we get our heads together and we release this state health officer's report on e-cigarettes and a health advisory that goes to all the physicians in the state of California. A health advisory had always just been used before for communicable disease alerts. So in February, then we released this e-cigarette media campaign called Still Blowing Smoke, trying to raise awareness that this is not just water vapor, that these products contain nicotine, and it's the next generation of cigarette for the next generation of addicts. So the same day that we released the media campaign, the whole website is hacked by the notblowingsmoke.org, and there's all of these kind of nasty comments on their website and attacking Dr. Chapman. So a lot of people wanted us to sue them for, I mean, they took the fonts, they took everything. But we decided, you know what, we're just gonna ignore them, and that turned out to be the right strategy, because if we had sued them, it just would have given them more coverage of their issue. So the e-cigarette work was incredibly important because it was like flipping a switch. The people, decision makers, all of a sudden became interested in this tobacco issue again. 2016 was like this remarkable year. We had had so-so state legislation passed, but in 2016 we had these 5 bills. So it cleaned up exemptions in the state clean indoor air law and also prohibited using e-cigarettes anywhere that you couldn't smoke. The tobacco-free school law, which had only applied to schools that were actually getting tobacco use prevention funding, now applied to every public school, 24 hours, 7 days a week. E-cigarettes were defined as a tobacco product. The tobacco retail license now applied to e-cigarettes, and it went up to an annual fee of $265, and there was increase of the age of sale to 21. These bills were all passed in special session, which meant when the governor approved them on May 9th, they went into effect on June 9th. It was a pretty heavy lift to implement all of those laws within a month's time. So the miracle of 2016 continues. $2 tobacco tax passed. And you have to know it's hugely expensive to mount these initiatives. They tried many, many times to get a tobacco tax through the state legislature. they failed at the ballot box twice. So we get this. So we have to say to ourselves at the Tobacco Control Program, are we going to continue going where we've been going, or do we need to do something different? So we really looked at this vote as a mandate from the people to do something different, and I'll tell you why. So almost 2/3 of Californians voted for that $2 tobacco tax. And in June of 2018, R.J. Reynolds got on the ballot a referendum to repeal San Francisco's ordinance which banned the sale of flavored tobacco products and menthol cigarettes. 68% of the people in San Francisco voted to keep that ordinance. And you have to know San Francisco has unusual demographics. There's not too many families with children there because it's too expensive. So for 68% of the people to vote for that, that was pretty incredible. So just to put this in perspective, there were a number of referendums on the 2018 ballot. People in California cared about redirecting some of our prevention mental health funds to address the problem of homelessness. People in California cared about having better standards for farm animals, and people in California want to get rid of daylight savings time. But people in California care more about the tobacco issue. So I go back to what Dr. Kaiser said in 1990. There's no valid argument in defense of smoking, so that's where we start from. And we start looking at, well, what are other states and what are other countries doing? And from Public Health Ontario, there's this very bold statement is there's no justification for incremental declines. We can no longer tolerate compliance on this, complacency on this issue. And, they published this document which has these goals from other nations. And, British Columbia, 10% smoking target rate by 2023. But look at Finland, 2%, and it's for all tobacco. And I have to say, that made us stand up. Like, we want to beat Finland. So we come across this article by Mike Fiore, and he looks at declines in smoking rates under the Clinton administration, the George W. Bush administration, the Obama administration. It's much faster under the Obama administration. Why? You had a 62-cent federal tax increase, you had the Affordable Care Act, you had the TIPS campaign, you had communities putting prevention to work. And so he sends the trajectory out that we can get to, as a nation, 0 smoking prevalence by 2035. So we think, we're California, we can do that. And he identifies all these things that need to be done. We need to have taxes done. We need to have media campaigns done. We need to, target priority populations. We're doing that. We've invested so far to date $65 million with the $56. Tobacco 21, done. Investment in tobacco prevention and control at the CDC levels, done. So we think that we can get this done in California. So then the question is, how are you going to get it done? So we looked at what people have said. And the FDA says their approach to dealing with this problem is we're going to lower nicotine levels. Well, we didn't find that very motivational. So we said what we want to do is lose our jobs, and we want to just end tobacco use in California. We're the California Tobacco Control Program, but we think that it's time for a paradigm shift to move from tobacco control, and we need to move the discussion to, we need to end this once and for all. And so you're probably running through your head, but what about e-cigarettes? What about e-cigarettes? So I think we can all agree that, cigarettes have been engineered to be as addictive as possible. But I would suggest to you that e-cigarettes are being engineered to be as addictive as possible. So this is a quote from a vape shop owner in the Bay Area during the referendum to repeal San Francisco's flavor ban. And he himself says, well, I can see why people want to regulate this product. Juul is his best-selling product. It has significantly higher amounts of nicotine, and he himself considered them to be the most abusive company in the business. I don't know what happened in Maryland, but Juul tried to promote a youth prevention program to California schools. Deja vu. They've been very successful at using social media and social influencers to convince people to use their product. They've been taking this ad out in Sacramento, which is the state capital, which I believe is just to influence state legislators, like, we're the good guys. We really are trying to convince people to just use this product to move from combustibles to e-cigarettes. We want parents to know that their kids shouldn't use that product. So I know that the harm reduction strategy is popular within a certain segment of public health. In California, we consider the harm reduction strategy to be a nicotine maintenance strategy. We understand that people they like this strategy because they want to continue to use nicotine without the harmful effects. People don't want to be stigmatized for using the product. Seems like a friendly business approach, seems like a politically friendly approach, and you've got some prominent public health people promoting this approach, such as a former U.S. Surgeon General, Richard Carmona, and Derek Yak, who used to be with the World Health Organization. But in California, we're saying we want people to be truly free of nicotine addiction, and that switching is not quitting. We want to help prevent nicotine addiction, and we want to help people quit for good. And if you look at the data, most of our success is coming from preventing initiation. It's not coming from the cessation side on the prevalence. Nicotine is a powerfully addictive drug. Most of the addiction occurs during the teen years and early adulthood. It has a harmful effect on the brain in terms of reducing impulse control, mood disorders, deficits in attention and cognition, which may have some influence on people's ability to pay attention in school, graduate from high school, go on to college, and earn a decent living. Nicotine actually happens to be on California's Prop 65 list because it's a neurotoxin. So this is one of the other problems I have with e-cigarettes. There's no manufacturing standards. There's probably better standards for the shampoo that you use this morning to wash your hair or the toothpaste that you use. We are at the mercy of the manufacturer. Most of these products are being manufactured in China. Over 15,000 flavors, the grape, cherry, mango. I swear, I think people think they're getting vitamin C when they're using this product. But we all know that these are chemicals that are created in laboratories. Our laboratories, as well as partners that you're working at, are finding that some of these flavors cause inflammation, they're cytotoxic. Our labs at the Department of Public Health are doing research with people in New Zealand and CDC on the MAO inhibitor effect. Dopamine is the drug in your brain that makes you feel good, pleasurable. Some of these flavors that we've tested have a moderate to high MAO inhibitor effect, which means that they're not breaking down the dopamine. The flavoring agent is crossing the blood-brain barrier. There's growing evidence of the cardiovascular and asthma risk from these products. And I ask you to think back on your high school physiology anatomy class. Your lungs are kind of a fragile organ if you think about those alveoli. Yes, there's not an epidemic of popcorn lung right now from the diacetyl, but what's the long-term effects? And when we start looking at these chemicals, diacetyl has a lot of cousin chemicals. They're just different by a carbon or a hydrogen. So we're just like not even getting down to where we need to be. And there is a legal pathway for e-cigarettes to be approved. And so one of the things in the Tobacco Control Act is it has to be federally approved. It can't just benefit, yes, you have a lower risk of lung cancer. It has to have a population-based effect, right? So we have to weigh the scale of initiation versus cessation. And from the work that I do, harm reduction messages are incredibly hard to communicate and be understood in the way that you want them to be. So if you tell somebody who's been smoking for 20 years, yes, this is a safer product, you should use that. But what do teens and young adults hear? This product is safe. So there's considerable proof that your health will be greater if you don't use these products, and you'll have more money in your pocket. So I'm not convinced that we should be moving people to e-cigarettes. And one of the things that really annoys me about some of these e-cigarette cessation papers is that they're counting switching from combustibles in their quit rate. And some of these articles that I look at, they're reporting on success at 3 months. When we published the success of the California Smokers Helpline, it was a 12-month success rate. And this was like huge because nobody believed that telephone cessation could be as good as face-to-face counseling. Some of the studies, they're looking at cross-sectional data, and they're not really, in my mind, taking into consideration all of the other things that are going on in the environment with tobacco taxes, the Affordable Care Act, TIPS campaign. So I don't think we need to apologize that we don't embrace harm reduction. This might be a great strategy for fields like HIV, but this strategy of harm reduction is a financial windfall for the tobacco industry, who wants to keep hooking kids and create lifelong customers. Tobacco addiction is expensive. We look at our data, most people who are addicted to nicotine are low-income people. So we think that this should be the last campaign to end the war, and we think that California is the place to do that. So again, how are we going to get down there? So I have always looked at the work in California as that the innovation comes at the local level. It's not coming from the state health department. But my job is to identify what's working great at the local level and to scale that up. So people are playing around with ordinances to stop the sale of flavored tobacco products, menthol cigarettes, looking at maybe moving all sales to tobacco-only stores, phasing out combustible products. There's this tobacco-free generation idea. Oh, that slide didn't work. So this slide actually shows that the data for California, that around 63% of California adults support banning the sale of flavored tobacco products. 56% of California adults support banning the sale of menthol cigarettes. About 53% support phasing out the sale of combustible products, and about 46% support an immediate ban on the sale of combustible tobacco products. And when you look at those who strongly disagree, the percent is so much smaller than on the other side. So we think that there's the political will. We understand that there's going to be opposition from Philip Morris, R.J. Reynolds, and Juul. So you may be thinking this is mission impossible. We think it's possible, and here's why. So this summer, Beverly Hills, which is a unique community, was considering a ban on the sale of flavored tobacco products and menthol cigarettes. This vice mayor, during the public hearings, keeps pushing, I don't want to just ban the sale of flavored products and menthol cigarettes, I want a complete ban. And you could just see the city attorneys going, it wasn't on the agenda that way, it wasn't on the agenda that way, we cannot change it at this point. This guy is a former executive from Paramount Studios, and he is our champion. We wouldn't let stores sell edible rat poison for human beings or allow glue sniffing salons to be available. We don't allow the sales of marijuana in our city, which is probably actually less damaging than tobacco. If we truly want to lead, we need to have the courage of our convictions. They are having study sessions about this issue in Beverly Hills as we speak. So the race is on, and in California, we've got 16 years to get there. Thank you.
Thank you for that wonderful presentation. I think California kind of gets the reputation that, oh, it's so liberal, and it is, but it's not uniformly kind of to the left. So I was wondering if you could talk a little bit about kind of whether there's any sort of pockets of political resistance, not from the industry, but just from kind of people, and how do you get, the majority of folks on board?
Well, first of all, I hope I convinced all of you that tobacco control work in California is not easy. It's not easy. People say that all the time. You do that because it's so easy in California. There was a lot of opposition that we overcame. So, yeah, California's not uniform. If you look at the Bay Area is the leader, and they pull everybody along with them. So when San Francisco passed the menthol ban, that was like incredible. So Yolo County actually did it before San Francisco. Yolo County is kind of a suburban rural county outside of Sacramento. And the health officer there actually happens to be Ron Chapman, who was the former state health officer. But we've been working on this flavored ban stuff, and people have been playing around with it throughout California, mostly Northern California, a little bit in Southern California, and they've been playing with different strategies of just working on flavors, or moving them to tobacco-only stores and stuff. But what San Francisco did was huge. That they said it's all flavored and menthol cigarettes, and then they went through a referendum process. It's like the state's on fire with flavored and menthol policies that are complete bans now, and now there's a bill in the state legislature about it. They're even doing this in rural areas. So there's resistance in certain areas, but people care about their kids. And in rural areas, they care about their kids. And that's why you see them starting lots of times with these smoke-free parks kind of bills. That gives them the opportunity to figure out how you mobilize and engage a community, you get kids involved, you testify in front of city legislatures and stuff. So yeah, there's a difference in where these policies are being passed, but we move people along. And the great thing about state legislation is it creates a level playing field, so that's where we want to be. And what you see a lot of times with the policy work in California is that it gets to a critical mass, and somebody at the state legislature says, ooh, we ought to have a state law.
Just a couple of things, April. One is you mentioned social norms, but can you just say a little bit more about how California has thought about social norm change and how important you think it is in the program? And secondly, can you speak to, so part of the cigarette tax has gone into TRDRP, which is Tobacco Research Program, so research in California. And can you say something about what you think the role of that has been throughout the program as well?
Okay. So the California Tobacco Control Program did take a little bit of a different strategy than many states. We said that prevention and cessation are outcomes, and the strategy needs to be changing the social norms around tobacco use. So we set out to create a program to change the world in which kids grow up in. So we do not have a youth-focused media campaign. We do not have youth-focused interventions. We leave that to the Department of Education, the FDA to do their media campaign. We don't invest heavily in cessation. We're probably the only state in the country that doesn't give away free nicotine with our quit line. We think that's the job of the health care system to do that. So we have focused on changing social norms, and how is that done? It's through policy change. We fund every local health department. We fund nonprofit agencies to be tobacco advocates. We train them on how to do policy change. And I look at federal government restrictions, and they talk about like, oh, no advocacy. But you all know that policy is a cornerstone of public health policy. So we fund that. They can't lobby with our funds, but they can advocate with their funds. When they go visit elected officials, the health department takes somebody with them who can do the lobbying. They take the person from the American Lung Association or the American Cancer Society. So that's kind of the social norm change thing. I think one of the other secrets of the success of the California Tobacco Control Program is the tobacco-related disease research program. So we have incredible relationships with the research community. And the way that that enabling legislation was written was that they were supposed to feed the program intervention. And so we have people like Lisa Henriksen, Pam Ling, who are actually going to the Board of Supervisors, and they are testifying on these issues. when we have media campaigns, we're going on the edge of what you can say. So we're trying to translate the science that you guys create into a 30-second commercial, right? And there's something lost sometimes in translation. So we go to people like John Samet and Kurt Ribisel and Pam Ling, and we show them the ads. Can we say this? Can we say this? Can we say that? And so then we know where the edge is, where you can go or you can't go, because you could get sued. And the thing about media campaigns is you need to be provocative, right? To get people's attention, to cut through the clutter. And the media landscape has changed dramatically from 1990 to 2019. So when we look at the media campaign, we kind of look at it as a surfer trying to catch the wave. If the surfer is behind the wave, he never gets into shore, right? And those are those dull media campaigns that are talking heads, that they're giving the message, but they don't engage you, right? If the surfer is in the wrong place in front of the wave, wipes out. So these are state taxpayer dollars. You do not want to have a wipeout. It costs a lot of money to make ads. It even costs a lot more money to place ads. So you don't want somebody saying this is a ridiculous use of the money. So we're constantly trying to find that sweet spot in the wave to take the surfer all the way to the shore of being provocative, but not so provocative that somebody says this is a waste of state dollars.
Thank you for a great talk. Could you talk a little bit about how, if at all, the changing policy environment around marijuana has impacted your work?
So we're pretty concerned about that. And the concern is that the marijuana legalization will erode, especially smoke-free environments. And we consider smoke as smoke, so we consider marijuana smoke to be in our lane, that we can address that. But when people are working on smoke-free multi-unit housing policies now, you have a constituency group that didn't show up previously, which is people who smoke marijuana. And the way California state law is written on marijuana is you can't smoke it anywhere, you can't smoke a combustible product, but you also cannot smoke it in public. So where is the space for people to smoke marijuana? We also have in California, a number of jurisdictions have passed smoke-free fairgrounds or smoke-free events. And what the cannabis manufacturers and producers like to do is have these events, right? And they have sampling of their events. And so, we've seen them try to go to Del Mar Fair in San Diego, which has a smoke-free fairgrounds, and have an event where you're putting on, smoking and sampling and stuff like that. So in that case, the advocates found out about it and they said, whoa, 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 Del Mar Fair Board, you have a smoke-free policy, this can't happen. So what happened was that what snuck into the cannabis regulations was a little loophole that an event organizer can get a one-time only, special event license for smoking at those events. So I think it's a real issue. And in California, among teens, marijuana use is about 4 times higher than it is for cigarette use. So it's a big problem.
Hi, thank you for your presentation. Can you talk more about when you introduced the $2 tax extra to the tobacco in California? And what was the notion that was circulating, like arguments that were circulating around the public around that time? Was that in general positive, or were there any sorts of like negative arguments?
I did not know till the very end, like that this proposition would pass. And, on my free time, I had gone out and collected signatures, which is not a very fun thing to do. And then I did phone banking, which is even a less fun thing to do. If you can imagine cold calls to people asking them to vote for Prop 56. And the arguments are, we're regulated enough, we don't need more of this. It's a boondoggle for, the doctors who were going to get money and for hospitals and things like that. So the polling was not very accurate on that, and when we woke up the next day and saw that it had won and the margin by it won by, it was like unexpected, a wonderful gift. And the tobacco industry spent huge amounts of money. The thing that was probably different about this proposition than the others is that you had this miracle happen in the state legislature with all of those bills. So there had been a lot of attention paid to important tobacco control issues just in the kind of maneuvering that in discussion of those bills. And then with the launch of Tobacco 21, we did a big press release. Plus, you have this backdrop of the e-cigarette media campaign. So all of these things kind of came together and probably created a softer environment that people were ready to vote for this, and they were really concerned about the e-cigarette issue.
Thanks. I'll just add my thanks to everyone else because your presentation was great. So you talked about how you've allocated like over $50 million to targeting these priority populations. And I just wanted to know if you could speak to some of the details of that, like what priority populations you've identified and what specifically you're doing to target them.
Okay. So Proposition 56 said that we had to spend at least 15% of the funds to accelerate declines in tobacco use amongst these populations that had high rates of smoking. So, adult smoking rates in California have dropped by over 50%. Smoking rates for women in California have been under 10% for the last 8 years. But certainly certain communities, American Indians, African Americans, LGBTQ have much higher smoking rates. California has a very large Latino population. They have lower smoking rates, but when you look at the 3.2 million smokers, about 1 million of them are Latinos. So you can't just look at the smoking rates alone. So we have an oversight committee that had identified like 18 priority populations. Well, that's a little bit unmanageable, and some of the populations were like recently incarcerated. We have no surveillance data on those populations. So what we did was that we chose 8 populations to focus on, and it's American Indian, African American Black, Hispanic Latino, Asian Pacific Islander, LGBTQ, rural, behavioral health, low income. So for some of those populations, we put out grants. We created statewide coordinating centers, and then we put out regional grants in areas where they had large numbers of Latinos or LGBTQ community. And they're working on policy and system change. And in our grants, we identified 7 topic areas that we felt would accelerate and move the issue forward. It didn't matter what community that you were from. And you had to pick at least one of those. So they were things like smoke-free multi-unit housing, the flavored tobacco product issue, density and zoning issues, doing better on system change within the healthcare system, behavioral health in terms of identifying and treating tobacco use. So they had to choose one thing from that list, and then they could do other stuff. For tribes, we just put a RFA out on the street last week to 4 tribes. California is a little bit different because we have about 120 federally recognized tribes where other states have maybe like 6, 10, something like that. And so we're going to hopefully create great relationships with tribes, and the tribes in California are, the capacity is different. Some are very sophisticated. Some of them, because they have casino revenue, have done a lot in their communities already. And we heard from those communities when we went out and did consultations. Some of them wanted to work on tobacco taxes and collect the state tobacco tax revenue from the sales on the tribal lands for the state, and then they would get to keep the revenue. Others were just at the point like, we need to do a better job of addressing cessation in our clinics. We're doing a behavioral health initiative, and have a kind of targeted focus on residential treatment centers because the smoking rates in those places are like 70 to 90%. So we're trying to create tobacco-free campuses, do a better job identifying and treating tobacco use. We have partnered with our nutrition program and our Office of Problem Gambling to take a wellness approach. So it's not just we're trying to get you to create a tobacco-free campus, but hey, do you want to introduce healthier eating? Do you want to introduce, exercise programs? And it's kind of interesting. We're finding out that in some of these residential treatment places, the residents themselves create the menus. So there's an opportunity. They like mashed potatoes in this one place. There's an opportunity for people to introduce, healthier eating. With the low-income population, we have not released this RFA yet, but we want to partner with 211 call centers. So those are the safety net providers, right? You have food insecurity, can't pay your utility bill. We're having a harder and harder time getting people to call the quit line, and if you look at the data, and I think this is happening in all states, the call volume is going down. It's mostly middle-aged white women who are calling the quit line. It's harder and harder to find smokers. You know that from your telephone surveys. So we just think that 211 call centers are a great place to try to identify smokers or where there's a smoker in the home, and we will incentivize the 211 call center to refer to the quit line, and then we will incentivize the person to stay in the cessation program. So we helped publish a supplement in the American Journal of Preventive Medicine in January where we looked at this Medicaid Incentives to Quit program. And not surprisingly, what we found out is that if you incentivize smokers to stay in the cessation program, they stay in the cessation program and they have better cessation outcomes. So we're kind of trying to take that research and translate it to this new environment.
We just have a minute, but I wanted to ask you one more question. So when I think of California, obviously a very public face of the program has been the anti-industry ads from very, shocked everybody. And so powerful, and you've done that again with the e-cigarette ads. Again, just looking back over the decades of the program, can you say how important that, if at all, that anti-industry focus has been?
I think it's been one of the keys to the successes of the California Tobacco Control Program. So all of you have learned about social determinants of health, probably in your classes, about where you live, housing, job security, job income, how important education is to later health. But we look at industry as a determinant of health. It's not just the tobacco industry, it's the alcohol industry, it's the chemical industry, it's the oil industry. They are engaging in behaviors that are detrimental to the health of individuals and communities. So it's public health's role to protect public health, and we have to take on the industry. So when we started that in the 1990s, exposing the behavior of the industry, I don't think there was any other state who joined us. Well, maybe Massachusetts. But people said to us that's an inappropriate use of state taxpayer dollars to go after this industry. And that's not a polite thing to do. So our job, our enabling legislation says our job is to prevent and dissuade tobacco use. So in the 2000s, when we were evaluating our media campaign, we used to do these large telephone surveys of California adults and then outside of California, and we would ask them their attitudes about secondhand smoke and the tobacco industry. So one thing we found out is that among smokers in California, if you had strong negative feelings about secondhand smoke, you're a smoker, you have strong negative feelings about secondhand smoke, and if you're a smoker and you have strong negative feelings about the tobacco industry, you're more likely to have quit intentions and to make quit attempts. We see that as a cessation strategy. The other interesting thing to me was that the attitudes of smokers in California about secondhand smoke were very negative, and they looked more like non-smoker attitudes in the rest of the country, that the rest of the country did not have very strong negative feelings about secondhand smoke. So both secondhand smoke and the anti-industry strategy are cessation strategies. And if you're not using them, you're not using all the tools in the toolbox.
I think we're at time, but thank you so much for such a fabulous presentation and just all the work you have done to be like a role model for the rest of us. So thank you very much.
You're welcome. Thank you.